You might be wondering, what should I expect and do during ketamine therapy? If so, you are watching the right video. In this compilation, I'm going to share everything you need to know about what happens during ketamine therapy, from the initial steps and infusion experience to emotional responses and more. Plus, stay till the end to learn 3 techniques to navigate a challenging ketamine experience. Are you wondering what to expect during a ketamine treatment? Then you are here watching the right video today. My name is Dr. Sam Coe, and I am a ketamine infusion specialist in Palm Springs, California. And today I want to share with you what to expect during your ketamine appointments. So every clinic does it a little bit differently. So I want to share with you what our process looks like. So normally, once the patients have gone through the initial screening and medical record review, then the patients will get scheduled for infusions. And when they come into the clinic, they'll do a little bit of paperwork as usual anytime you go to a doctor's office. And then we would get your weight and then bring you into the infusion room. Once you're in the infusion room, that's when we connect the patients to the monitors, specifically the heart rate, the cardiac rhythm, the oxygen level, the respiratory rate, blood pressure, just to make sure it's 100% safe. Now, once we get that vital signs checked and everything is clear, then we will establish an IV. Sometimes that's in the hand, sometimes it's in the inner arm, someplace where we can get a solid working IV. Then the dose is typically based upon the patient's body weight, and usually we'll start them at 0.5 milligrams per kilogram. Now, before the infusion starts at the clinic, we will examine the patient, listen to their heart, lungs, etc., check them out thoroughly. Now, one of the things that we do a little bit differently at our clinic is we set an intention. So the patients are requested to declare their intention aloud. And that intention might be feeling more peaceful, letting go, forgiveness, gratitude, self-love. And it's very specific to the patient. Not everyone has the same intention because, again, it's unique to what that individual wants. Now, once the infusion starts, because it is an infusion, it's very slow, right? So it's slowly administered via an infusion pump, roughly over 40 minutes. During that infusion process, different emotions may come up. Tears, joy, sadness, fear. And we invite our patients to just go with the flow and accept and allow whatever comes up, kind of surrendering to the process. In addition, just kind of witnessing what is coming up during the infusion, being an observer almost. And then lastly, to breathe, because we can use our breath as a way to regulate our autonomic nervous system. So initially when it starts, pretty slow onset, and then it's kind of like an airplane taking off. You're on the runway, it's kind of going up, 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 up. And then once that infusion is completed, then the effects will rapidly fade over 5, 10, 15, 20 minutes. Then we bring our patients up because they are reclined in a chair listening to relaxing therapeutic music, some aromatherapy, they got the eye shade, so it's an internal closed-eyed experience. And then we finish with a discussion of the experience itself, and then try to pulling back something from the infusion. I always tell our patients having the extraordinary experience and then bringing it back to the ordinary life in the form of an integration action. So briefly, that is our infusion process. So if you're curious, I hope you learned something, and stay tuned for the next video. What will it be like during my first ketamine experience? And one of the things that I want to let patients know is on your first experience, it's completely normal to feel a little bit of anxiety, a little bit of apprehension before you start the ketamine treatment. One of the metaphors that I give to my patients is it's kind of like you're at a swimming pool and you see a diving board. And although you know that the diving board is safe and other people have done and jumped off the diving board, you haven't personally done it yet. And so that can be scary. So when you're about to begin that ketamine infusion, you might have a little bit of nervousness, a little bit of butterflies in the stomach, similar to if you're going to jump off that diving board. But once you take that first jump, overcome your fears, then you'll discover, oh, hey, that wasn't that bad, that wasn't that scary, and you'll probably even look forward to the next jump. Now, in addition to having a little bit of nervousness and apprehension, you may also have certain emotions come up, or certain memories, or certain people, or colors. There's been a wide variety of experiences that patients report. And so although not everyone has the same experience, it can be pretty interesting and unique to you. So be prepared to have uncertainty. Be prepared that certain memories or emotions that have been repressed may come up, and that it's okay if these old things do come up. That you're going to be protected, you're going to be safe, you're going to be a bit dissociated because ketamine is a dissociative anesthetic. And accordingly, you'll be able to handle and face whatever may come up, given that you're at the right clinic with the right people. You may also have certain insights about your life, about certain things that you need to change, about certain people that you may need to call or text or just reach out to. So if you get those insights, feel free to journal those after your ketamine infusion so you can take action upon them. Now, the last thing that I do want to mention is there might be certain emotions that are powerful that may come up. So for example, you might feel sadness, and you may even feel tears kind of well up and come to the surface. So if that were to occur, feel free to cry. Feel free to let those emotions out during the ketamine therapy. We do our best to create a protective little space so that if these emotions come up, you'll know that you'll be safe and protected. So again, please be prepared for various emotions, a little bit of nervousness, maybe certain insights, maybe certain emotions, maybe certain people. And know that anything can happen, but although you may not always get what you want, you'll always get what you need. Today, I want to share with you 3 navigation tools during a ketamine infusion. Number 1, witness. Number 2, breathe. And number 3, surrender. So I'm going to talk about each one of these in step. The first tool is witnessing. And by witnessing, I mean being the observer or noticer of whatever is coming up for you during that experience. You don't necessarily have to get entangled with whatever is coming up. Just be that witnesser of what is coming up. Remember that ketamine is a dissociative anesthetic, meaning that you're going to be disconnecting the mind from the body, which will allow you to observe and witness from that third-party perspective. The second tool I want to tell you about is breathing. You know, in the field of emergency medicine, we talk about something called the ABCs, airway, breathing, circulation. It's really important to breathe, obviously, because we need it for life. But it's really fascinating because that is both within your unconscious control as well as your conscious control. So for example, if you don't think about breathing, well, guess what? Your body's going to do it for you. But at the same time, you can influence and control your breathing. So whatever may come up, whether it's a pleasant or unpleasant experience, remember to breathe. And in particular, if there's a challenging experience, you can just remember to take in some deep inhalations and exhalations. As a matter of fact, why don't you just do one right now? Take in a slow, deep inhalation and a slow, deep exhalation. When you do that, it actually increases your parasympathetic nervous system, which is the part of your autonomic nervous system that allows you to rest and relax. It's the opposite of that fight or flight response. So when you're doing these deep breathing exercises, it'll help you calm down. And so you can use that as your second tool. Finally, the third tool for you is to surrender. Letting go of control, allowing, accepting. And when I say the word surrender, I don't mean give up, because there's a subtle difference. Surrendering is allowing and accepting whatever may happen and also not resisting it. Trust that the ketamine is going to work for you. Trust that your unconscious mind will take you where you need to go. And so just allow and experience and surrender to whatever may come up. So to summarize, your 3 tools are witness, breathe, and surrender. Let me know what you think about this. Leave me any questions. Why am I crying during my ketamine sessions? You might be crying because ketamine seems to dissolve the layer between the conscious and the unconscious mind. So if there's a lot of tears or sadness that's, quote, underneath of the hood, it might just bubble up to the surface. So having those emotions of sadness, releasing the tears, may be really important. It makes me think about this quote: "What soap is to the body, tears are to the soul." So when we're crying, it's actually a form of release in a way. So we have our urinary system, we have our digestive system, and those are releasing various things, whether it's urine or waste. So similarly, our tear glands are a type of excretory system, and it might be tears from joy. It might be tears from sadness. It might be different emotions that have not been processed in the past. And so during the ketamine therapy, if that comes up, that can be pretty normal for some patients, especially if they've been holding various emotions down. And just a reminder, tears can be from sadness or it can be from joy as well. It makes me think about another patient that I had who for 20 years, they did not cry at all. And during all 6 initiation ketamine series, that patient cried for each and every session. Literally, the eye mask that we give to our patients, that one was soaked with tears each and every time. So, what can you do about this? Well, anticipate that this could occur during your ketamine session. Also, know that if it does happen and you're crying, that can be within the normal range of a human experience. I've been thinking about sadness, and sometimes we cry because we're sad, we're mourning, we have emotions, or our emotional body is in pain. Well, one of the beautiful things that I've noticed is that people who can experience the most negative emotions, well, that to me means that they have the capacity to also have the most positive experiences. So as a metaphor, if you think about a piano, let's say, within the normal range of a piano, there's really high notes and then there's really deep, dark, somber notes, right? And for a human experience, it's actually having a full, wide range of human experiences rather than just a narrow subset. So know that the tears may be normal and that it may just be things that have been held down, and anticipate it, that it could occur, and don't be too alarmed. Now, what's going to be really important at the end is to process it. And that might look like talking with your therapist, talking with your ketamine practitioner, talking with a psychedelic integration coach. All of these things can help. And if you don't have access to that, it may simply look like journaling, creating art, but some form of integration to help process those tears that have come up. Questions that I was asked recently was about, should I keep my eyes closed or should I keep them open? At our clinic, what we recommend is for every patient to have a set of eye shades, something to keep their eyes closed. And the reason behind this is a lot of our lives, we're really focused externally, looking out for reasons or looking out for what's going on and observing externally. But frankly, we don't spend a lot of time looking internally. During the ketamine experience, it's really an internal experience. Eyes closed, got the eye shades, covers out all the lights. And when we journey inward, that's where we can find our internal own self-healing in a way. So the vast majority of our lives, as I mentioned, it's outward focus. But during the ketamine infusion therapy, it's crucial to be inward focused. Thank you so much for watching. I hope this compilation has provided you with valuable insights and practical tips for your ketamine therapy journey. Remember, understanding what to expect and how to navigate your experience is key to a successful treatment. Now, if you found this video helpful, please give it a thumbs up, subscribe to our channel, and hit the notification bell so you never miss an update. Stay informed, stay prepared, and see you in the next video.